As said yesterday, there are 1,083 COVID-19 patients in hospital, 26 fewer than the previous day. 145 cases are seriously ill, requiring oxygen supplementation, and another 19 are in critical condition in ICU. Of those who are very ill, 134 are seniors above 60 years old. Professor Dale Fisher is here to assess Singapore's current situation. He's a senior consultant at NUH's Division of Infectious Diseases. Welcome to the show, Professor. Professor, while the number of patients in ICU remains relatively low, 19 as at yesterday, there are over 1,000 still warded at hospitals. Would you describe that as overwhelming the healthcare system?
Thanks for having me back, Haryanto. No, really what we're talking about is the number of people that need intensive care, the number of people that need oxygen or are deteriorating and might need oxygen, these type of people. Actually, there's still a lot of people in hospital that, if you like, are left over from the period when we were still admitting everybody to hospital or some to community care facilities. So some of those rules are still being tweaked, and I must say very successfully the number of hospitalised patients that don't need to be there for reasons of hospitalisation, that number's coming down. The numbers to really look at are the ones that are on oxygen and the ones that are in intensive care, which is still quite manageable. And furthermore, to deal with any risk of being overwhelmed, as you know, there's the development of really some innovative efforts to create new facilities for different categories of patients. So less people will have to be in hospital for just in case we're going to observe you. They can be observed in community facilities, which are a little bit more ramped up for observation and even providing some oxygen. So also there's other people, such as those infected in nursing homes. They could be completely well, but they need to be taken away from the other residents of the nursing home so they don't get infected, but they need care. So rather than providing that care in hospital, then hopefully we can have facilities where we can provide that care while they get over what is probably and hopefully a very mild infection with COVID.
So, Professor, having said that, are there other numbers that we should be looking at as well, apart from ICU or seriously ill? Say, for example, the number of patients that have been discharged, for example.
Not really. Of course, we like it when patients are discharged, but the burden on the hospital is really, though, and on society for that matter, is the people that are severely well. Someone coming into ICU is going to be there for 2 weeks. That's the average. People on oxygen, it'll be a bit less. But no, I guess if you're going to look at anything else, you would be looking at the number of people that get infected, particularly seniors, and particularly if they're unvaccinated, because they're the ones of highest risk of progressing to seriously ill. So we're still very concerned about seniors that get vaccinated, that are unvaccinated.
Professor, the current wave of infections emerged about a month ago. Is our COVID-19 situation peaking? And if not, when do you think that will be?
So this is one of the unknowns, really. We don't know how high this peak will go. We want it to go slowly, right? We don't want to see a big spike in severe cases. That's exactly what would overwhelm hospitals. So we'd like to see we're back to the days of trying to flatten the curve. We'd like to see a gentle rise in the numbers, and I think this is precisely what government's looking at, because if that rise is not gentle and it's too steep, then we know that hospitals can become threatened, and that's when you're likely to see some community level interventions to try and cool things off and stop the numbers. As I say, particularly if you're seeing large numbers of elderly and large numbers of unvaccinated people infected, then they're the ones that we worry most about. both for their own health and for the health of the health system.
Health Minister Ong Ye Kung told Lian He Cao Pao this week that the government is monitoring hospital capacity and may have to impose more restrictions if the situation worsens. Professor, based on what we've just discussed, the number of hospitalized cases currently, those seriously ill as well, are we heading for tighter restrictions?
Well, I think I can comfortably say we're not going to look at a rapid easing of restrictions like many would have hoped. I'd like to think the travel restrictions, the quarantine for return travellers could be lifted, because really we're only finding 4 or 5 cases a day that way. And when there's 1,000 in the community, it doesn't seem like there's a particular advantage in going to so much trouble to find these 4 or 5. But having said that, I think we're certainly not likely to see for quite some time, mixing of large groups for social occasions and things like that. But will we go backwards? I think this is the big question. I think it's possible. I think it's more likely to be restrictions than it is to be, harsh lockdowns. Everyone go back into your house and close down non-essential businesses. I don't think we're talking that, but it might be limitations in dining or something like this, the mask off activities, but actually it's the ministry and the MTF that know where the clusters are happening. So I guess the restrictions are more likely to happen in those particular settings. I hope it doesn't happen. We're certainly, I guess, knocking on the door of that. But we have to get through this wave. We have to get to the other side. If we said let's lock down and stop trying to exit, then we're just going to have to face it another day. Some people are saying, why don't we just stop all this and go back into lockdown? I think you need to remember that there's terribly sound reasons for coming out of this, and whether it's people's mental health or whether it's livelihoods or whether it's other non-COVID related diseases, we have to, after a year and a half or more, confront this and say we need to get through this, and we want to do it as carefully and safely as possible, which is a precedence, especially compared to other countries that have had a lot more severe disease and death than us, obviously.
Prof, thank you so much for your perspectives. That was Professor Dale Fisher, and Senior Infectious Diseases Consultant at NUH.